Mr. President, we've traveled a great distance to get where we stand today. With the bill we unveiled last night, we begin the last leg of the historic journey. The American people and President Obama have asked us for health insurance reform, and they are two things that we must have above all. Number one, make it more affordable for every American to live a healthy life. And two, do so in a fiscally responsible way that helps our economy recover. Well, Senate Democrats have listened, and we've written a bill that will save lives, save money, and save Medicare. As the President asked us to do, this bill will not add a dime to the deficit. Quite the opposite. In fact, it will cut it by $130 billion in the first 10 years, and by as much as $750 billion in the first 20. We do this by keeping costs down. The critical reform will cost less than $85 billion a year over the next decade, well under President Obama's goal. We'll make sure every American can afford quality health care. We'll make sure that more than 30 million Americans who don't have health care today will soon have it. And we'll not only protect Medicare, we'll make it stronger. These numbers are as impressive as they are important to our nation's future. And though we're proud of these numbers, these figures, we can't afford to overlook what this is really all about, Mr. President. More accurately, we can't afford to overlook who it's really about. This is about the parent who cannot take a child to the doctor because insurance is too expensive. Their employer canceled it, or they lost their job. That's why we're making sure every American can afford good coverage. This is about the small business. Small business in Nevada or someplace else in this country that had to lay off employees because it couldn't afford skyrocketing health care premiums. That's why we're cutting those small businesses' taxes. This is about the woman with high cholesterol, or the man with heart disease, or the child with a hay fever who can't get help and can't get insurance. That's why we're stopping insurance companies from deciding they'd simply rather not give health care to the sick. This is about the family who has to make that terrible choice between its mortgage and its medications. When this bill passes, the only choice they'll have to make is which insurance policy offers them the best coverage. They'll have a choice to make, and it's a good choice. The choice is which policy best suits them and their family. It's also about our mothers and sisters and wives and daughters who can't get the proper testing they need to detect breast cancer. It's inexcusable that women should have to wait to get the screenings they need. That's why we're making prevention and wellness a priority in this legislation. For these families and these businesses, for our economy's renewal, our children's future, and our nation's promise, the finish line is in sight. I'm confident we'll cross it soon. And I'm once again inviting my Republican colleagues to join us on the right side of history.